Hi, it's a very common occurrence that whenever a doctor tells you that you have got a high cholesterol, you have goosebumps and something rings bells in your ears. Today we'll be discussing about hypercholesterolemia or higher levels of blood cholesterol, which is a complete panel known as lipid profile. I'm Dr. Rehan Omer, I'm a consultant cardiologist, and today I'll be discussing with you some important aspects about high cholesterol. So whenever a doctor gives you a blood test known as lipid profile, that means that he wants to check total cholesterol, LDL cholesterol, HDL cholesterol, as well as triglycerides. So the combination of these four spectrums, they comprise of lipid panel. So whenever you have a poor lifestyle, bad dietary habits, abdominal obesity, diabetes, thyroid disorders, or kidney disorders, these are the risk factors that raise serum cholesterol or blood cholesterol levels. So when we order lipid profile, the first thing that we are interested in is to find out the amount of total cholesterol in your blood. But that is not the complete picture. So we break down that cholesterol into different components, and those components are LDL or low density lipoprotein cholesterol and HDL or high density lipoprotein cholesterol. If I talk briefly and sum it up, LDL cholesterol is the bad cholesterol, is the nemesis, while the HDL cholesterol is the good cholesterol, like the friend. So you need to have as much low cholesterol as you can have. So the lower, the better. LDL cholesterol are the backbone of the cholesterol plaque that obstructs and causes stenosis in the coronary vasculature, resulting in heart attacks, and in the brain, resulting in strokes, in the kidneys, resulting in kidney failure. Ideally, a normal person should have an LDL cholesterol of less than 100 mg%. If the patient has diabetes or high blood pressure, his LDL cholesterol should be less than 70 mg%. And if the patient has established coronary artery disease or established cerebrovascular disease, his LDL cholesterol should always be less than 55 mg%. What about HDL cholesterol? HDL cholesterol is basically reverse LDL. It picks up the LDL from the bloodstream, takes that LDL and stores that into the liver. So that means that HDL cholesterol is the friend that removes the atherosclerotic or clot-forming cholesterol from the blood and stores that into the liver, which means that raised HDL cholesterol should be the aim, and we need to keep that at between 40 and 55 mg%. Low HDL is also an independent risk factor for heart attacks. The third component is triglycerides. Triglycerides, they are just like acute phase reactants. They signify the importance or highlight the existence of underlying cardiovascular or cardiometabolic disease present in the patient. Triglycerides are high in patients who are obese. Triglycerides are high in patients who have got diabetes, who have got thyroid disorders, or who have got nephrotic syndrome. Meaning thereby, if the triglycerides are high, we need to rule out different important conditions. However, if the triglycerides are very high, then they also have to be treated because of the fact that they can cause pancreatitis and they can also cause coronary artery disease. So this is briefly about the lipid profile that we order in our patients. But if we find out that patients have got abnormal values, first of all, the first important thing is lifestyle modification. You don't put your patients immediately on medications until and unless it's absolutely necessary. So lifestyle modification means early to bed, early to rise, good diet, a healthy diet. Saturated fats should always be removed from the diet. Polyunsaturated fats can be taken. Remove refined carbohydrates from your diet, and also eat plenty amounts of good quality proteins and fibers and good amount of good fats. Then exercise. The AHA, American Heart Association, and the ADA, American Diabetes Association, and the American College of Cardiology all have unanimously decided that at least 150 to 180 minutes per week of physical activity is mandatory in order to decrease the frequency or the risk of coronary artery disease. So lifestyle, good diet, good exercise, and if all these parameters with or without pharmacological treatment. The treatment of choice for hypercholesterolemia is statins. Patients who are allergic to statins or intolerant to statins, they can be put on other novel lipid-lowering drugs. I hope you have understood the basic concept of hyperlipidemias. In order to find out more about cardiovascular disease, you should click the icon, subscribe my channel. I'm looking forward to seeing you soon on different programs.